Dangers of dental work while pregnant. Will it hurt your baby? Is it safe to get dental work when you're pregnant? Is radiation from x-rays going to hurt my baby? There are so many myths surrounding pregnancy and dental care regarding safety for the mother and the baby. Let's break it down. There's two topics that can cause the most concern when it comes to treating pregnant women. Number one, radiation, and number two, anesthesia. How can we properly diagnose the dental needs of a pregnant patient without x-rays? We can't. How can we perform dental treatment such as fillings, root canals, crowns, extractions without local anesthesia? We can't. Well, I have some great news about radiation. The amount of radiation needed to take dental x-rays in a modern facility like ours poses no risk to a pregnant woman or to an unborn child. I also have some great news about local anesthesia. The amount of lidocaine needed to perform most basic dental procedures in a relatively healthy pregnant patient poses no risk to the mother or to the child. Let's back up for a minute. Why are we even talking about this in the first place? What's the history of these fears or concerns? If I'm sitting here telling you this is all safe, how did it come to pass that it was even ever perceived as unsafe in the first place? It all gets back to radiation and anesthetic fears. Most of our understanding of the effects of radiation on unborn fetuses is actually from animal studies and nuclear accidents like the atomic bomb, Chernobyl, etc. Being exposed to an atomic explosion and receiving a few digital x-rays can't be equated, but for a generation of Americans that lived through the atomic age and the Cold War, the word radiation sends chills down their spines. There are local anesthetics, anesthetic gases like nitrous, and IV anesthetics that are contraindicated in pregnancy. Lidocaine is safe and has been studied extensively for its safety, and it's the most commonly used anesthetic in dentistry today. Historically in dentistry, before lidocaine, there were anesthetics that commonly caused allergic reactions in patients that would pose great danger to the mother and to the fetus. This has to be the source of these fears in my estimation. These products are no longer used in dentistry today, but this isn't something you're going to see on the History Channel where you can learn about this. People still commonly say Novocaine, which is an ester-based anesthetic, the old dangerous kind that caused allergic reactions. This just goes to show you how hard it is to shake history and old ideas. Novocaine was last made in 1948, and here we are, still talking about it and fearing it. It's time to move on. In a perfect world, most women should have dental work done when they aren't pregnant. The fact is, pregnancy, especially a woman's first pregnancy, is a very special time for a woman, and with it there's often a shift in a woman's mindset and consciousness about her own personal health and how it affects another person now. It's not uncommon for a woman to suddenly be more concerned about her dental health when she becomes pregnant. Obviously, I'm not a woman and I've never been pregnant, so I hope it doesn't seem too presumptive of me to say all these things. These are just my observations as a clinician and as a human being on this planet. Another big reason we see lots of pregnant patients in the dental office is because there's just something about being pregnant that makes a tooth hurt maybe a little bit more or start hurting a lot during pregnancy. Pregnancy can often wreak havoc on a woman's immune system, resulting in a phenomenon known as pregnancy gingivitis, where a previously healthy woman may experience severe inflammation in the gums during pregnancy. Too many women put off dental care during pregnancy, figuring that unnecessary exposure to radiation and local anesthetics is bad for the baby, when in fact the exact opposite is true. Putting off dental care during pregnancy could result in undetected and untreated infections, which could result in hospitalization. This would constitute an actual emergency to the mother and child, which is totally avoidable. There are many reasons pregnant women avoid dental care during pregnancy. Sure, there are concerns of safety for the fetus, but lack of education on the matters I've been discussing is a huge problem. For every solid piece of information out there like this, there's probably 100 equally compelling pieces of misinformation out there. Another large problem in the United States is lack of access to care. Almost every week in my practice, I see a patient that has not been to the dentist for several years because they did not have dental insurance and did not have the desire or the ability to invest in their dental health. There's no denying that women and children in the United States, and all over the world for that matter, are disproportionately affected by poverty. Is it important to let your dentist know if you're pregnant or think you may be pregnant? The answer is yes. Having this piece of information, having a complete medical history on any patient for that matter, is an essential part of individualized care and making relevant recommendations to any patient. I often recommend having more frequent hygiene visits during pregnancy to decrease the risk of pregnancy gingivitis that can sometimes lead to acute periodontal infections. A primary oral health goal during pregnancy should be to avoid excess plaque buildup with excellent home care and frequent checkups. I had a patient one time tell me that she lost a tooth during each one of her pregnancies. I'm sure her children went on several guilt trips over that one. There's some evidence that suggests periodontal disease and poor pregnancy outcomes like low birth weight and preterm birth may be associated, but the exact relationship is not completely understood. On a side note, life doesn't exactly get much easier once a baby is born, so get into the dentist while you can. To all mothers and mothers-to-be, weigh the risks and do what makes you feel comfortable. Just know that having your teeth examined and knowing what the risks are of delaying potentially necessary dental treatment is much better than not knowing anything at all, so see the dentist.